Hello, hypertension resistors. Although during the clinical trials there weren't any deaths from COVID-19 vaccination, since then there have been several serious reactions, including death, reported to the Center for Disease Control VAERS reporting system. Today, I want to give you the truth about the COVID-19 vaccine side effects. I will show you how to go to the Vaccine Adverse Event Reporting System, also known as VAERS. I'll tell you what's the best recommendations for premedicating when you go get your vaccine. And stick around until the end when I'll tell you the update on Ivermectin. Let's get to it. Vaccines have minor side effects and just rarely could have severe side effects. If you're concerned about severe side effects or if you've had a severe reaction to a vaccine before, check with your doctor or an allergist to determine if it's safe for you to get the vaccine. Here I will use some clips from the Clinical Outreach and Communication Activity webinar to give you the truth about vaccination side effects. Let's listen now to Dr. Sarah Mbaeyi. She is the commander in the clinical guidelines team at CDC.
People can be assured that confident that the COVID-19 vaccines are safe. Safety has been a number one priority in the development and approval of these vaccines, and they have gone through all the same safety tests and meet all the same safety standards as other vaccines. U.S. Food and Drug Administration has issued an emergency use authorization for these vaccines, and in order for an EUA to be issued, there has to be adequate information on not only safety and effectiveness of the vaccine, but as well as manufacturing quality and consistency, as well as making a determination that the known and potential benefits outweigh the risks of the vaccines. There are a whole host of safety monitoring systems in the United States that will be used to rigorously continue to assess the safety of the vaccines. The people who should not get either of the COVID-19 vaccines are those people that have had a severe allergic reaction, such as anaphylaxis, after a previous dose of an mRNA COVID-19 vaccine or any of its components. Those people that have had an immediate allergic reaction of any severity to a previous dose of the vaccine or any of its components. And those people who have had an immediate allergic reaction of any severity to polysorbate. And again, polysorbate is not an ingredient in the vaccine, but cross-reactive hypersensitivity between these two, between polysorbate and polyethylene glycol, which is a vaccine component, has been observed. And so until we know more, until the investigations can reveal more information, that is also a contraindication to vaccination. Persons with an immediate allergic reaction to the first dose of an mRNA COVID-19 vaccine should not receive additional doses of either of the mRNA COVID-19 vaccines. It is important for providers to determine whether reactions reported following vaccination are consistent with immediate allergic reactions, which would indicate a contraindication to additional vaccine doses, versus other types of reactions commonly observed following vaccination, such as a vagovasal reaction or post-vaccination side effects, which are not contraindications to the second dose.
Although severe reactions or anaphylaxis is rare, if you're concerned about that, make sure you ask your doctor about how to protect yourself. And perhaps you need to get your vaccine in a healthcare facility. But if you're still concerned, then perhaps you need to bring your EpiPen with you if you have one, or ask your doctor, can you get one? Severe side effects are rare, but if you're interested in finding out the severe side effects that have been associated with the vaccines, go to the VAERS website and check it out for yourself. The VAERS is an online reporting tool that anyone can report to, including doctors, providers, patients, and families. And the CDC is closely monitoring these adverse reactions in order to determine the safety of the vaccine. There you will find how to report adverse events to VAERS and what to report to VAERS. You can go directly to the database, and then you can select any items that you're interested in. I was particularly interested in the COVID-19 vaccine and deaths from the vaccines and all deaths from the COVID vaccine. So I selected all of that. And check the appropriate items from the boxes. Just scroll down and put in the dates that you're interested in. I selected December 2020 for all the remaining tabs until February 2021, since it's February at the time that I'm searching. And you scroll down and select send, and it will process it only if you include the BARS ID in one of the selections in item 1. So I have to go back up to do that in this search. And once you do that, it will give you a report. Some people are taking Tylenol, ibuprofen, aspirin, or some other medication to try to deal with the side effects from the vaccine. And there are many different theories on this, and so just check with your doctor to see what is safe for you to do. According to the clinical trials, the participants did use Tylenol and ibuprofen to treat their symptoms, and actually it didn't seem to bother them at all or seem to decrease the efficacy of the vaccination. So again, ask your doctor to see what would be best for you. However, what about Benadryl? Let me play a clip from a leading doctor regarding his ideal about taking Benadryl. Here is Dr. Syed MoBeen.
Well, that these things will not cause reduction in effectiveness. However, my preference will be you don't take it, or if you take it, you tell the people who are administering it. Here is the reason. Imagine for some reason you are going to get the allergic reaction. Now you've taken Benadryl, which would suppress it for, let's say, some minutes. Now you feel okay and you are coming back home, and then if you develop it because you had suppressed it, although it's a speculation here, then that would be a serious thing. What I mean is that if you have not taken it, any preventive medicines, then you sit down with the doctors and you stay under observation, and if you develop any reaction, they can immediately give EpiPen or epinephrine and fix it. That is a better situation than to take a weaker suppressor, which may suppress the symptoms at that time, but these might appear a little later. If I'm there, I would say, okay, because you've taken some medicine, I would like you to be here a little longer so I am sure nothing is happening.
Check with your doctor to see what might be best for you to do. Meanwhile, if you want to protect yourself from COVID-19, or if you get COVID-19 and you want to try Ivermectin, and you don't have a doctor to prescribe the medication, check out the link in the description where you can find doctors who will provide you with a prescription for Ivermectin if appropriate. If this video has been useful, like it, share, and subscribe to learn more about trending health topics and what everybody ought to know about hypertension. Thanks for listening, and I'll see you in the next video.